I am joined with another one of our brilliant speakers today, none other than Professor Dame Donna Kinnair DBE, Non-Executive Director from East London Foundation Trust. Donna, welcome to the studio.
Thank you.
I say it's a pleasure to have you, and we've got you for a short time because we're about to send you up on stage at 2 o'clock.
Yes, you are.
And your topic today, clinical leadership for community empowerment, improving access, experience and outcomes. Tell us a little bit more about what people can expect if they want to tune into that session.
So it's important as a nurse and as a clinician that actually we make sure that the people that pay for the services help us organise the services, help us tell us what the services should be so that it makes a difference to them. We often in health spend time organising our services along a clinical pathway that makes no sense to the person that has to use it. And therefore what I'm trying to do is say today that if we facilitate people telling us what they want from our services, how they can access them better and how we take services to them, they are more likely to use them. They're more likely to want to use them. They're more likely to trust them. And also it's more likely to make a difference to them. So if we want to improve the outcomes for the people that use our services, they've got to be front and centre. I, as a clinician, know my body, I know what's good for me, and we need to trust the people we serve to know what's good for them. So that's what we're going to be talking about this afternoon. And it's it not only improves their access, but it also improves their experience of the services. Because if you've managed to have some control over the environment that's been created, you're much more likely to enjoy it much better.
And is it that sort of mental shift that, the way we approach things right from the start, is that what you're hoping people really take away from the next session?
Yeah, I've always known that if we in health, we couldn't possibly in health provide the services that everybody wants or everybody needs. But actually, if we engage the community, they can help us do it. So even if we've got a huge workforce problem, we don't have enough nurses, we don't have enough doctors, we don't have enough physios, but we have huge communities that actually, if we were to stand behind them and give them the skills, allow them to use their experience, their skills, they will help us deliver services. And in East London Foundation Trust, I've seen that live. It's a mental health trust. There are people with lived experience that can help others in their communities. They can, I'm much more likely to listen to somebody that comes from my culture, my community, about their experiences, about what is good for them. And if we can give them the knowledge, the experience, the right skills, they can help us do our work.
Fantastic. And if you want to know more, as I say, Donna is on 2 o'clock, I believe. You're going to be on the other stream, so you have to flick streams, as I say, if you do want to jump into that session. But Donna, I know you were here yesterday as well at the show. Tell us about your show experience on day one.
So yesterday, I think, was catching up really. I met so many people that I haven't seen for such a long time because you come to Expo and they're all here. So I felt really excited about, just coming and meeting people, folks that... but I also think there was a lot to say. There was a lot we were told. I think Amanda's session was really good. I really believe that as an NHS, we can do so much better for our customers. And I think what struck me yesterday was that whether we were talking about inequalities, whether we were talking about care, whether we're talking about social care, we all know that we can do so much better if we work together. And I think that you can't do much better than that. As a community of clinical leaders, as a community of people wanting to serve the nation, then we can, if we work together, do so much more.
No, totally agree. And you're definitely not the first person with that outlook, with that attitude, about that collaboration and community. And how much do you think events like this do play a part in that, and in terms of, how the NHS, the healthcare industry as a whole, we bring people together for these couple of days every year. How much do you think of an impact these can have on the potential future and success of the industry?
So I think it has been so important. I think the NHS has got away from doing what it used to do really well. It used to give people space to breathe. And I think what NHS Expo does is that you day to day battle against the grind of having to deliver services, having to do the right thing, that often we don't have time to think. And in a way, we don't have the time to get excited about the services that we deliver and we want to deliver. And I think Expo, when you come away, take a breath, hear other people. I mean, I've just been in a session this morning and I'm like, I've got to meet them in Southwest because they've got to come over to Southeast London to help deliver some knowledge, friendship, learning to help us improve the services that we're delivering there. So, and I've just met the medical director and I've told her as well what I'm planning to do. So I think it gives us time to connect, it gives us time to recharge, and it also gives us time to think better about how we can deliver better services.
I think there's so much knowledge, so much experience in the room. It's just that springboard, if you like, isn't it? That you started the conversation, follow it up sort of post-show, and that is what is going to make the changes, if you like, to the industry as a whole. Sort of any sort of key takeaways or other highlights for you so far from your experience here?
So whether I've gone to a stall to hear about, recruiting from overseas, or whether I think there is a lot to learn at Expo from a lot of different people. And I just would say to people, if you haven't been, come. Because I'd forgotten, actually. I'm just going to be totally honest. I'd forgotten how much you can mix, learn, share. And actually, I feel really enthusiastic. It's only sort of my half of the second day. I've been here a day and a half. But actually, I found my enthusiasm again for the things that I've been doing for a very long time. So I'm really, really pleased. And I say to people, come.
Brilliant. Inspired words. Donna, it's been an absolute pleasure. Thank you very much for sharing your insights. As I say, Donna is on stage at 2 o'clock on the other stream, so if you want to jump in a session, you want to flick over there in the next sort of 10 minutes or so. Donna, thank you very much for your time, and thank you for joining us in the studio.